Hello, I'm urologist Omer Erdamakaya. What is shockwave therapy for erectile dysfunction? What results do we get? We will have a short video presentation about it. Shockwave therapy is an advanced technological treatment option that has been used in our country for about 10 years. What is shockwave therapy? First of all, we have to explain this. While any energy is generated, it has waves which it spreads around it. When you direct these waves into the body, it's called shockwave therapy. It was used in orthopedics and cardiology before urology and began to be used in urology due to positive results. So what happens when you direct these shock waves into the body? Revascularization in the tissues is expected. It is expected to improve the blood supply to the tissue and, of course, to revitalize the tissue. So if we look at clinical research, what are the results? In fact, there are not many studies, but in the studies it was observed that patients benefited from 50% to 70%, and positive results were obtained without Viagra in patients who usually had sexual intercourse with or without Viagra, and in patients who could not have sexual intercourse even with Viagra. So it has positive results. First of all, it is necessary to evaluate the patient's condition well, because when you type in impotence or erectile dysfunction on Google, these shockwave therapy ads are the first thing patients see. Of course patients see those ads there, inevitably. As I said, the clinical results are between 50 and 70%, there is no 90%, there is no clinical study that shows such a result. What are the positives? No complications, no risk. The procedure is simple, it does not distract the patient from his daily work. He has to come and go to the clinic 6 times. Other than that, what are the downsides? If the patient accepts such treatment, he has to take into account the possibility of no chance of success, because the clinical results are obvious. 50% to 30% of patients have no response after 6 sessions, and the treatment is not cheap. In other words, the patient should also consider the results of the treatment economically. Thank you for listening. Best regards.